Hi everyone. So today's video is going to be about how to prepare for the MRCP PACES. So before I go into this, just a brief note on my journey. So I think my channel subscribers and those who have viewed my videos earlier would know that I've already put up videos for preparation for part 1 and part 2 exams. So I had given my MRCP part 1 in 2020 January and I was able to score 723, and I'd given my part 2 examination the same year in November and scored 855. So after this, I had a very long gap till the first diet of 2024. So the main reason for me was my ongoing neurology residency. But I think additionally, one more factor which I faced and also many of my other friends who were preparing along with me was most of the times we weren't actually mentally ready to give the exam. So actually we felt that we weren't adequately prepared, or like fear of failing the exam. So we always kept postponing it, okay, because we've already completed part 1 and part 2. So in our mind, we have already completed 75% of the exam, and we're like, okay, we can postpone it. But please don't do the same mistake I did. So try to apply for paces whether you get a center or not. Please keep applying after you clear both your part 1 and part 2. Whenever you get a center, just enroll for a paces preparation course, and also subscribe for online videos and start preparing and finish it as soon as possible. So try to get rid of that mental block. So as I mentioned, I applied for the first diet in 2024 and I got a center in Chennai in March. And I was lucky enough to get a center on my first try, and I was also more lucky to pass it in my first attempt. So before we go into how to prepare for the exam, just a short note on the eligibility, the format, the different skills and stations in this exam, the pass mark for this diet, and about the fees. So first, regarding eligibility, so I think all of you know that you will need to have a pass in MRCP Part 1. So you need to pass in MRCP Part 1 to apply for PACES. And earlier there used to be a 7-year limit. So that means that you need to clear your MRCP Part 2 as well as PACES within 7 years of passing your MRCP Part 1. But that is no longer the case. Now it is the new policy which is introduced in 2024. That is the limited attempts policy. So there is no more time limit. You just have a maximum of 6 attempts for the MRCP UK. And the RCP does recommend 2 years of clinical experience after primary medical qualification. I think most of us, by the time we give PACES, we already have this. But anyway, this is a recommendation and I don't think that it is compulsory. So coming to the fees, it is £1,278 for international candidates. So as of the date when I'm recording this video, this translates to 1,35,000 Indian rupees. So coming to the format. So since the third diet of 2023, we have had the new format, that is PACES 23. So before we go into the PACES 23 carousel, so the PACES is a half-day examination. It will occur for around 125 minutes. So just a little bit more than 2 hours, and you will be assessed based on 7 core skills. So you will be assessed based on 7 core skills, which we will come to, and there will be 5 stations, and there will be 8 patient encounters, and a total of 10 examiners. So remember, 5 stations, 8 encounters, and 7 core skills. So this is the PACES 23 carousel. So in station 1, we have communication and respiratory system. In station 2, we have the first consultation station. In station 3, we have cardiovascular and neurology systems. In station 4, we have the abdominal system and the second communication station. And in station 5, we have the second consultation station. So remember that between each station, you have a break of 5 minutes. So between each station, you have a break of 5 minutes. But remember that you will not always start in station 1. It might be the case you will start from station 5, or you might start from station 3. But irrespective of what station you start in, the sequence of station movement will be based on this PACES 23 carousel. So coming to the most important thing, that is the 7 core skills that are assessed. So why are these 7 core skills important is, remember that in addition to getting an overall pass in the PACES, you need to pass in individual skills. Remember that you need not pass in individual stations. It's not necessary that you need to pass in individual stations. You only have to pass in each of these 7 core skills, and when put together, you should have an overall pass. This is how you pass the exam. So coming to the 7 skills, first is physical examination. So you will be assessed whether you're able to do a correct, systematic, fluent, and professional sequence and technique of physical examination. Next is identifying physical signs. This not only means identifying positive physical signs, but it also means that you should not identify signs which are not present. Okay, so this will be seriously frowned upon and could significantly affect your score in this particular skill. Next is clinical communication. So this includes eliciting a history which is relevant to the patient's complaints in a systematic, fluent, and professional fashion, as well as explaining relevant clinical information in a clear, structured, and fluent manner to the patient or the surrogate. Next is differential diagnosis, which is creating a sensible list of differential diagnosis which is relevant for that particular clinical scenario and patient. Clinical judgment would be to negotiate or select a sensible and appropriate management plan, investigation plan, as well as treatment plan, as well as applying clinical knowledge, including knowledge of law and ethics, which is relevant for that particular case. The sixth skill is managing patient concerns, which is addressing the patient's as well as the relatives' concerns and listening to the patient or relative and confirming their understanding of the matter and demonstrating empathy for the same. And the seventh and most important skill is maintaining patient welfare. So remember, irrespective of whichever station you are, so please make sure that you treat the patient, the surrogate, or the relative in a respectful and sensitive fashion. And you have to ensure their comfort, safety, and dignity. And remember that there is a very narrow margin of error for this particular skill. Even losing a few marks, which we will come to later, could just failing the skill could fail you in the entire examination. So coming to the stations and the skills which are assessed. So it's remember that in the 5 stations which I had mentioned, it's not that you're going to be assessed in all 7 skills. There's only 2 stations where all 7 skills is going to be addressed, which is the 2 clinical consultation stations. So remember that only in the consultation stations, all the 7 core skills will be assessed. So for example, in the system examination. So in the system examination, you're not going to talk to the patient. So obviously communication skill is not going to be assessed here. And in the communication station, obviously you're not going to do a physical exam or give a differential diagnosis. So physical science as well as differential diagnosis skills will not be assessed in these stations. But remember that the 2 consultation stations is where all the 7 skills is going to be assessed. So it's very important that you perform well in the consultation stations. So coming to the marking system. So there are only 3 marks that you could get. One is 2, which is a full mark, that is satisfactory. Next is 1, which is borderline, and 0, which is unsatisfactory. So how do the examiners decide what is a 2 or what is a 1? So actually on the day of the exam, all the examiners will independently assess the cases which are kept for that particular day, and they will calibrate what is a satisfactory score for that particular station. And this will be done for all 5 stations. So if you have got a full mark, it is satisfactory, 1 is borderline, and 0 is unsatisfactory. Now coming to how to get a pass. So how do you pass? So obviously you'll have to pass in the total. So the total is 168, and remember that this pass mark is for the first diet. This pass mark is for the first diet of 2024. Usually more or less it will be the same for the subsequent diets, but usually they reassess this every diet, and there might be minor changes, but this is the latest pass mark. So for a total of 168, you need to get 126. But as I mentioned earlier, it's not enough if you get a total. Even if you get 130, 135, and you fail in a particular skill, you will be failed for that examination. So remember the 7 skills I mentioned, you have to pass in each and every skill. And if you see in patient welfare, even losing 4 marks, more than 4 marks will fail you in this particular skill and this exam. So even if 2 examiners are going to mark you 0 for this, and 1 more marks you 1, this station, if this particular skill you fail, you will fail irrespective of your total mark. So make sure that you have to pass in each and every of the 7 core skills. So coming to the time. So as I mentioned, the PACES examination is for one total of 125 minutes, and this includes the short 5 minutes break between each station. So your communication stations will be for 10 minutes. So communication stations will be for 10 minutes. Your system examination stations, that is respiratory, cardiovascular, neurology station, as well as abdominal examination, will be 10 minutes. But remember that for the system exams, in this 10 minutes, 6 minutes you will be examining the patients, and for 4 minutes it will be a question and answer session by the examiner. For the consultation station, you will have 20 minutes. And remember that in this 20 minutes, 15 minutes will be the patient history taking, examination as well as communication. And the remaining 5 minutes will be a question and answer session by the lead examiner. So we just go into short into each of the stations. So coming to the communication station. So in the communication station, you will have written instructions for that particular station, which you have to read during the 5-minute break. So please make sure that you go through the instructions clearly, understand the theme of that particular communication station, and read through the fine print. So in that 5 minutes, just forget about your previous performance in that station, whether it is good or bad. Just read this particular the template and appropriately approach the station. So the theme for a communication station could be something like breaking bad news, something like a medical error, or explaining a patient about a DNR. So there are many different scenarios. It could be regarding driving regulations for a patient with epilepsy, or an epilepsy patient who wants to get pregnant. So this is, once you prepare for the exam, you will get acquainted to the different themes or different templates for the communication station. But the important take-home point is, please read the written instructions very clearly in that 5 minutes break. And remember that you will have 10 minutes for the communication station, as I mentioned earlier, but you will have absolutely no you will have no interaction with the examiner. So the role of the examiner in this station is completely passive. So all the examiners will do will be observing you and marking you. There will be no question and answer session in this particular station. It is totally, they will be assessed in a passive fashion by the examiner based on the patient or surrogate interaction. So remember that in this 10 minutes, try to finish your communication, your addressing concerns within 8 minutes, and the remaining 2 minutes, make sure you summarize that particular theme. And you will be given a warning bell once 2 minutes are left, so that you could mentally prepare for the same. As I mentioned, no interaction with the examiner, and examiner will be only observing you. They'll be playing a completely passive role in this particular station. Now coming to consultation station. So those who are doing their post-graduation in India, this is something similar to our long case. Okay, so this is very, very important. So please make sure you do your consultation stations well, because all 7 skills, remember that all 7 core skills are assessed in this particular station. So what is done in this station? You will have an integrated case approach. So you'll be doing 3 things. One is you'll be taking a relevant history, a relevant and focused clinical examination, and number 3, you will be communicating with the patient or the patient relative or the surrogate regarding the management plan, the investigation plan, the treatment plan, and very importantly, you will be addressing all their concerns. So don't forget to address the concerns. Remember that, I know it sounds a lot and might sound difficult. You will have to do all this within 20 minutes, and actually not within 20 minutes, but actually within 15 minutes. So remember that even though this station is for 20 minutes, your history taking, examination and communication should conclude by 15 minutes. The remaining 5 minutes will be a question and answer session by the lead examiner. So you'll either be talking to the patient or the surrogate, and just like the communication station, you will have a written instruction which could be the form of a referral letter from the GP. And as I mentioned, please go through it, read it 3 times, read through the fine print, and sometimes you will be actually able to get some clues about the possible diagnosis for the case even based on the GP referral letter. So make sure that you read this, keep your mind clear, forget about your performance in the previous station, and you have 5 minutes to read this written instructions. So as I mentioned, you will have 20 minutes for this station, but remember, in 15 minutes, you will have to complete a history, you will have to complete the examination and communication. So please keep practicing and make sure that you are able to do this while you're practicing within 15 minutes. This comes only with a lot of practice, because I know it is difficult to take a history examination within 15 minutes, but remember that it should be focused. Don't try to make sure your history or negative history, everything is focused to that particular clinical scenario and theme. And 5 minutes, you will have a question and answer session with the examiner. So remember, 15 minutes is for history taking, examination, communication. The remaining 5 minutes will be a question and answer session or a viva session with the lead examiner. Now coming to the clinical system examination. So you will have the respiratory, cardiovascular, neurology, as well as abdominal system examinations. Station 1 will be respiratory, station 3 will be cardiovascular and neurological, and station 4 will be the abdominal system. remember that you will not be having any like for the communication and consultation station, you will not be given 5 minutes to read the instructions. So once you enter the clinical system examination station, just above the patient in the wall, there will be a short note which is stuck. So for example, there will be a 45-year-old woman who's having exertional dyspnea. Please examine her cardiovascular system. So you know that, okay, you have to examine the cardiovascular system. And please pay some attention to the history and make sure that the diagnosis you're giving is somewhat related to that. Because sometimes what could happen is, in case they are not able to put a particular system case, they can put a normal patient. So sometimes they can put a completely normal patient who has a normal system examination. So that time you can just mention that I believe that this patient's examination is normal, and you could propose a differential diagnosis based on the short clinical vignia which is stuck on the patient's nearby the patient's wall. So timing is 10 minutes, but remember that you don't have all the 10 minutes to examine the patient. You will be given only 6 minutes for physical examination, and you will get a reminder bell at 5 minutes that you have 1 minute left. So 6 minutes to complete a physical examination, and this is quite challenging for the neurology station. So the only way that you're going to do the neurology clinical system exam within 6 minutes is with practice. So keep practicing again and again till you do it within 6 minutes. I think for the other systems, it's relatively, I wouldn't say easy, but comparatively easier to finish the physical exam in 6 minutes, but it's definitely challenging. So even as a neurology resident, I found it very challenging to complete the neurology examination for that particular case within 6 minutes. So keep practicing. And after the 6 minutes, you will have a 4 minutes question and answer session with the lead examiner. So please note, as I mentioned earlier, you could have a normal patient. So if you're not getting any signs and you're very confident about it, please don't cook up any false physical signs or diagnosis. That will be seriously frowned upon, and you will lose marks in the physical science the physical science core skill marking. So in case it's normal and you're definitely sure, you confidently mention that the physical examination is normal and suggest DDs based on the written instructions which is given for that particular station. So now coming to what I had used for preparation. So I'll just share what I had done, so it might be useful for those who are preparing. So regarding to online material, definitely past test videos are useful, and personally I felt the past test videos very useful for communication station. So actually for communication station, I was able to score full mark in both of them. So definitely the past test videos are very useful for communication station. I didn't use any other online source for other than past test for this particular station. And I also found it very useful for sequence of examination. So the past test videos help you brush up the proper sequence of examination. So it's a highly recommended online source. But remember that it might not be only enough. Please attend the PACES course. So near your place, definitely there will be some good course. So usually the theme of the course will be, they would make you see a lot of cases. You will have mock tests, mock exams, and they will probably give you marks so that it will give you feedback about how you currently stand. So I had attended the Pass the Paces course, which is in Chennai, conducted in Savita Medical College, and definitely it was useful, and I don't think I would have passed without attending this course. And the third most important thing is to have a motivated study partner. Okay, so make sure you have a study partner. And why I'm saying you should have a study partner is, so before the exam, one of you could take the role of an examiner, one of you could take the role of a candidate. You could mark each other, and playing this role playing could also, and seeing the exam from both sides, from the examiner sides and the candidate sides, would give you more insights to the exam. And my study partner was he was doing his rheumatology in the same institute I was, and we used to go and examine cases in the medicine wards, in the cardiology wards. And remember, this exam, it's very important to keep practicing, and having a study partner would definitely help you in that way. So as I mentioned again and again, keep examining cases, and also try to examine normal cases so that you can get the feel of what is normal. So especially for respiratory exam and cardiovascular exam, neurology exam, what is a normal reflex, normal heart sounds. So though they do sound quite simple, on the day of the exam, when in that anxiety, you could probably get confused. So if you have, like examined normal patients who have findings multiple of times, it will be a cakewalk for you in the real exam. And remember that this is not a theory examination. So please don't open your books, read all the criteria for COP, criteria or different all the fine print for all the theory exam. This is not needed at all. The question and answer session will be purely clinical questions. So once you mention the positive physical signs and tell your diagnosis, they might ask you some simple questions on that. For example, if you get a COPD case, they'll ask you what investigations you want to do. You don't need to read a book to know that you need to order an X-ray or a CT chest or pulmonary function test, right? So try not to read too much of books, but in case those who want, many people had asked me like, if so, what books? So actually I had used this particular book. I hadn't actually read it fully, so I just did go through a little bit of it. But again, remember that this is not a theory exam, this is a practical exam. So just please keep looking at more patients, practice the communication station, and I think you'll be able to pass if you do this. So if you guys have any doubts, you could contact me anytime, and thank you.